The FDA also gave emergency authorization for HydroxyChloroquine. We're having some very good things happening with it. It's shown very encouraging, very encouraging early results.
This drug that you and I have talked about, HydroxyChloroquine, talked about it with Dr. Grace, is already being used. And one patient was described as Lazarus, getting up after he was like on death's door. And they started getting a protocol of hydroxychloroquine at Lenox Hill, and it's suddenly like Lazarus up from the grave. I mean, that's an actual case.
Watching people in the media talk down a potentially life-saving medicine because a politician they don't like has endorsed it is probably the most shameful thing I, as someone who's done this for 29 years, have ever seen.
Hydroxychloroquine is a very safe drug. It has been given to tens of millions of individuals in the world since its approval.
We have purchased and we have stockpiled 29 million pills of the hydroxychloroquine, 29 million. A lot of drugstores have them by prescription, and also, and they're not expensive. We're sending them to various labs, our military, we're sending them to the hospitals, we're sending them all over.
In their protocols, doctors have protocols for doing certain things. They don't even mention complications from hydroxychloroquine because they're so uncommon.
On their webpage, the FDA is offering generic guidance to manufacturers on how to produce hydroxychloroquine.
So the hydroxychloroquine is something that I have been pushing very hard. I got the very early approval from the FDA.
If things don't go as planned, it's not going to kill anybody. It will be wonderful. It'll be so beautiful. It'll be a gift from heaven if it works. If some other person put it forward, they'd say, oh, let's go with it. You know, what do you have to lose?
There's a lot of stuff floating around about the hydroxychloroquine.
Very good.
And the media seems to be almost rooting for it not to work.
Things are happening. I haven't seen bad. I've not seen bad. And one thing that we do see is that people are not going to die from it. So if somebody's in trouble, you take it, I think.
And it's being used worldwide. Yeah, and it's being used worldwide.
This study done by a reputable center, double-blind, randomized trial, showed that there was an improvement in outcomes in patients who took the hydroxychloroquine. It's not a panacea, but you have to respect data.
In my open, I put in a sound of the woman who was a Democrat from Detroit, a Michigan representative, who said, you know, thank God for Donald Trump even mentioning this. Once I got on the hydroxy, I was fine.
Well, your open was spot on.
Is there something else?
It's politicized. No, it's just, come on. It's like the never Trumpers. It's like, oh, if he's for it, we got to be against it.
I've seen things that I sort of like. So what do I know? I'm not a doctor. I'm not a doctor, but I have common sense.